screen said, warning, battery exhausted. Poor thing. All right, we're going to do some deep tissue in sports. Posterior line, iliac crest, ischial tuberosity, glute max coming from the iliac crest, tailbone coming across and down like that, hooking up with TFL on the front to form the IT band. Looks like that right along the outside. If this is a pre-event, I'm going to just get this guy moving, okay? Effleurage. And remember to have consent from your client about working in glutes. Most athletes are going to beg you for it, but make sure you get consent before you start pawing around in somebody's glutes, okay? Post-event, we're going to do compression, okay? Slow and firm, not hard, firm, okay? We got a big guy like this, use 2 hands, okay? We're just trying to squeeze the inflammation out of the tissue and up into the lymph nodes so the lymph nodes can distribute the material, the liquid, the inflammation, the excess interstitial fluid. Remember what hamstrings do. Hold right here, okay? Hamstring, they flex the knee, okay? So I'm going to pin and stretch the hamstrings, okay? I'm going to do the medial head, which is semimembranosus, and then I'm going to do the middle head, which is semitendinosus, and then I'm going to do the lateral head, which is bicep femoris, okay? All the way up to the attachment. Get right onto, you'll feel the bone. That's no longer muscle, that's bone right there. That's the ischial tuberosity. It looks like a hoop down at the bottom of the pelvis. I like to put my elbow right on the ischial tuberosity and pin and stretch like that. Doing okay?
Yep.
Okay. Forearms. If this is rehab or if we're doing deep tissue, I'm going to hook into the muscle. Again, I like to use flexion and extension. If this is a really big person and you're not comfortable doing that, if you're not strong enough, if it's hurting you or causing you to use bad body mechanics, then by all means don't do it, okay? And then just come in with that, okay? I like to get things moving, whether it's sports or deep tissue. One of my favorite things is to come underneath the leg like this, so now I have his entire lower leg supported against me, and I'm just going to lift. So this is what the glutes do. This is extension of the hip. And what I'm going to do is I'm going to grab right onto that glute attachment, right at the SI joint and the iliac crest, and I'm just going to pin and stretch glute max right through there. If I feel something somewhere else, by all means, move into it. Rotation, internal, external, extension. It's hard to do flexion when the client is in the prone position, but I can certainly do extension. I can do abduction and adduction, okay? All depends on what you're comfortable doing. Piriformis, right in there. Is that okay?
Yep.
Piriformis is the muscle that usually activates sciatica. There we go. So ask, when you're in piriformis, ask the client, do you feel any radiation, any sort of sensation going down your leg? If they do, you probably just need to back off a little bit. Unless it's, if it's a 3 or a 4, then you can probably keep going. But if it's, 7, 8, 9, you need to back off of it because you're just causing discomfort at that point. Okay, glutes, max, medius, minimus, piriformis, TFL's in the front, IT band, bicep femoris, semitendinosus, semimembranosus, 3 heads of the hamstrings, Gastrocnemius is the most superficial. Hold your foot right there, push up into my hand. That's gastroc, okay? Relax. Deep to gastroc is soleus. They have different attachments. Remember, the gastroc crosses the knee joint. Some textbooks say that it assists in flexion of the knee. Its primary function is plantar flexion, which is that movement. So that is passive plantar flexion because I'm doing it. Push up into my hand. That is active plantar flexion because he did it, okay? This is dorsiflexion, the dorsal side of the foot, the plantar side of the foot, okay? I like to grab right onto our friend Achilles tendon with my hands like that and take him into a deep but passive dorsiflexion to stretch that Achilles tendon. Okay? Very gently push up into my hand. 3, 2, 1, slowly relax. There. So we throw a little PNF in there, get the Achilles tendon to loosen. I like doing this on angles too. So rather than just straight down, I will rotate or invert and do it again. And then I'll evert or laterally rotate and do it again. Okay? All while stripping that Achilles tendon. Glute max, major, glute max, medius, minimus, piriformis, hamstrings, IT band, gastroc, soleus, Achilles tendon. There you have it.